All right, let's get started. Welcome to our second webinar of the year. We are so excited to talk about collagen today. We all have it, we all want it, we're all losing it, and we want to know how to keep it. So we want to tell you guys all of our synergy secrets on how to strengthen your collagen, how to make your skin look better. It all starts with collagen. So thank you so much. We can't wait to talk about this, and we can go ahead to the next slide. For everyone that is attending the webinar today, we are going to enter you to win 2 vials of Sculptra, our newest injectable that we are going to talk about in this webinar today. It is a great prize, and we will email the winner in the next few days after the webinar. So stay until the end. We've also got some exclusive offers that we will be offering to everyone that's attending today. Yay! If you are new to Synergy, welcome. We are 20 years old and we are female founded. And I honestly couldn't be happier working with women all day, every day. It's my favorite thing. Anna Churchill started this company 20 years ago, and we have since opened 6 locations, 2 in Virginia, which Amia is joining us from Midlow today, and 4 in the Raleigh, Cary, and Wake Forest area. We are a top provider of Botox and Juvederm in the nation. And we have the best of the best of the best when it comes to lasers and injectables and treatments and all the things. But what I think we really pride ourselves most for is tailoring treatment plans to each individual person. That's why we have so many things. Yes, everyone is so different and unique, and we need to be able to offer people what they need. So we have everything that you could possibly want. Yes. I am joined today by 2 of my favorite people on the team. Amia, again, is one of our amazing laser estheticians in the Midlow area. Hi, Amia.
Hey.
Laura, I get the pleasure of seeing quite a bit here at ITB. She is a very, very talented injector, and we are so excited to have them with us today. Amia, tell us a little bit about yourself and your background in aesthetics.
Yeah, absolutely. So I've been in the beauty industry for quite some time now. I started out doing makeup and I was a skincare trainer, but I am a master esthetician in the state of Virginia and I'm licensed in North Carolina. So since you miss me so much, maybe I'll come down there one day for
We
you,
need you to
okay?
come here.
That's it. I am oncology certified. I am nationally certified. So I think I'm one of 3 in the state of Virginia. So that's a big deal for me, but I'm very results oriented. So I'm super excited to be here and talk about collagen and just have a good time with you guys.
Yeah, I have to say something about Amia really quick. I was actually one of the first people to interview you, and within seconds, I was like, we have to have this person on our team. She is absolutely amazing. Not only are you so knowledgeable, but anybody that's going to come and sit in your chair is going to have a great time. It's just
Oh, that's
fantastic.
awesome. I love to hear that.
So fun and lovely and talented, and I just am honored to work with you.
Thank you.
And then Laura.
So I am Laura. I am one of the injectors here at Synergy. I am an advanced injector. I offer all of our injectable services. So from Botox to fillers to PDO threads to Radiesse, Sculptra, everything. I really like to get to know my patients, find out their reasons why, and then customize everything specifically for you, to you. I bring in my colleagues because this is not just a one-person approach. At Synergy, we really need to look at everything as a whole. We all work together. We're all going to come together to customize your plan and make sure that you're getting the right things. I started in plastic surgery and then went to injectables just because I found it so fascinating. I love learning about the human body and how your muscles are working, what your tissues do. I have had the pleasure of being a first assist in the OR, so I have seen what it looks like inside a face. I can absolutely, and I do picture that as I'm treating you. So that's a little bit about me. I've done a variety of things in my nursing career, but this is my passion. And doing things for the best of the patient is always going to be my number one.
Yeah, Laura's amazing. I've seen her work. We get to geek out every day.
Yeah.
It's my favorite thing to come in and talk to you about all the things.
Oh,
because
yeah.
we can just go on forever. I
Yes.
mean, you know so much. You are so knowledgeable. And it's just amazing to see you work and just your passion just spills out on everyone. And
I
it's
love
so
that.
much fun.
Yeah, I'm a big nerd. I love to research. If somebody's like, well, what about this? I'm like, well, let me
On
find the
it.
studies. I got it. Let's talk about it. Yes, I am huge into that
Yeah.
for sure.
We love you.
Oh, I love you guys.
And then me. I'm Emily. I started with Synergy 11 years ago. It'll be 12 in May. And I've done a lot here. I started at front desk, and then I was an esthetician and a laser provider for many years, and have most recently transitioned into our marketing department. So it's really been an honor to see all the different sides of this industry. I'm fascinated every single day. I mean, there's so much technology, there's so much science, there's so many passionate people. It's just so fun.
It is.
I can't say enough good things.
And you bring a ton of knowledge
Thank
to
you.
Synergy.
She really does. She really does. And can we talk about how Emily is serving them up in this picture? I
Exactly.
mean, come on. You look fabulous. I love it.
Thank you,
Love
guys.
her.
You make me blush.
Oh,
Well, let's get into what we are here to talk about today, which is collagen. And before we get into treatments, Laura, tell us a little bit about what is collagen.
yeah. So collagen is a protein, right? So it's our skin's ability to look youthful, to look firm, to have elasticity. It's what keeps us nice and plump. When I think collagen, I think plump. So it's something that we start out at 20 with the most collagen we'll have, right?
Beautiful.
And then every year we lose about 1%, which is absolutely drastic, sad,
Terrible.
like we
Yeah.
can't be having this. So even those patients in their 20s who are looking great already, but are like, okay, I really want to stave off that facelift. They're starting to feel a little saggy. That's normal. And it's not as simple as just replacing the collagen with a supplement,
Yeah.
right? I've done a little bit of research in that, and it's maybe beneficial if you're not getting all of those nutrients, but you really need to cause controlled trauma to your skin in order to get down deep, because your skin is a protective barrier, right? So if you're just doing surface level stuff or not really treating those deeper layers, you're not going to have that stimulation that you're looking for to prevent those wrinkles, to prevent that sagging.
Yeah.
So collagen is incredibly important. It's in our joints, it's in our eyes, it's all throughout our body. It's not just our skin. So we need to do the best we can to keep what we have and replace what's being lost. And then when we hit menopause, we lose about double what we're losing per year. So yay, aging.
Yay.
That sounds terrible.
I really like this visual, Laura, of why we need it. You can see the fibers breaking down, and then obviously you see the wrinkles happening.
Exactly.
I think we can pop into the next slide. Let's talk about what affects collagen loss.
Yeah, so
because it's a lot.
So life. You could summarize it by saying life, but aging, your sun exposure, right? It's something I feel like we didn't necessarily talk about even 20 years ago.
No. It's just now getting the
hype
attention that it needs.
Yes.
Right.
You need to be using that SPF. Like, it is going to be your biggest anti-aging benefit, truly. So your sun exposure, your lifestyle, if you are going out and drinking every day or on the weekends and smoking and have a horrible diet, that's all going to be affected. So protein is made up of amino acids. Amino acids we get from our food. Some of them we can't get from our food, but for the most part, our food, our diet. We need to be consuming the right things. And if we're not, we're going to continue to age even further down.
Yeah.
So that's a big thing. And then stress. I mean, any of my patients who are on know that when I ask your medical history and you don't say anxiety, I usually ask you because I'm like, that's our life.
Yes.
I mean, so the
stress girlies.
Absolutely.
Right.
And then, there's not much we can do as far as our environmental pollutants, but those are also something that are caustic to our tissues in general, which, I mean, that's just proven in science, our cancer risks, all of that. And then hormonal changes. Oh,
Love
perimenopause
that.
is coming real fast.
Read something recently that was like you have 3 age bursts, and I think
Ooh.
that it revolves around your hormonal changes.
I would believe that.
And I'm coming up on the next one, which is 34. So
I refuse.
what would you say, like 34, 60s, 80s?
Maybe. Honestly, I would think, if I think back to like my history, I would say my later 20s is when I probably
Yeah.
saw my first. And even like beginning of my 30s, I actually started getting horrible hormonal acne, and like my skin changed
Yeah.
horrendously. And I had no idea what was
Same.
going on. And I was like, what is this?
Yeah.
So I think that that time period, our body's doing this change, and we need to keep up with it.
Yeah.
So it's finding those solutions. And I think that's one thing that's really great about coming to Synergy is just that we do so much research, and we are so highly trained and specialized in this field
Yeah.
compared to colleagues throughout the country.
Yeah.
We really do a ton of research, all of us, even if it's by ourselves in a group. We're constantly training and just learning more on how to best treat you the most effective way and best way possible.
Yeah. It's an ongoing.
Absolutely. Absolutely.
I think above all, and Amia, you can attest to this. First and foremost, when we're looking at what causes collagen loss, if you haven't done anything and you're thinking about adding on some metastatic treatments or, implementing some injectables, you have to start with sunscreen. This isn't in this webinar today, but I think it's important to note that if you are not wearing sunscreen every single day, none of this stuff is really going to be insured. So
I mean, seriously.
Easy thing that you can do. And it's
yes.
ask people in the treatment room, like, do you wear daily sunscreen?
Exactly.
It's a very simple solution to a bigger.
It's crazy. So many people still aren't, and people don't even realize that 90% of extrinsic aging comes from sun damage. So do your part. Just put some sunscreen on. That will help you out big time.
We've got some good ones. We've got Elta MD Revision. I mean, they are formulating them a lot better these days. It's
good.
not
They are.
like a boring like zinc oxide,
Exactly.
Right.
A lot of
They don't smell awful.
No.
They're not super thick. So
Exactly.
they've done sunscreen has come a long way.
Yeah, it has.
Massive.
So let's talk about some basic skin treatments. We have a wide range here of regenerative skin treatments that we offer, starting with very basics all the way up to injectables, all the way up to surgical. But let's get into some of the smaller things that if you're just kind of dipping your toes in are great options for you to begin your journey on. So Ellie, Amia.
Yeah, I'm so excited to talk
You know
about
how
LED.
I feel about LED.
I'm so excited. You see, I'm like, let me jump in. LED is an amazing anti-aging treatment. A lot of people sleep on it and they don't realize that it can do so much for your skin. We're starting to see LED in a various amount of colors. They treat different skin concerns. The most popular ones we see is probably like the blue light, the red light, which is the one that we're going to actually highlight, okay? So red light is really going to help promote collagen production. It's going to actually sink all the way down into the dermis, and it also cuts down on inflammation, which we need to talk about inflammation being the main cause of aging, for intrinsic aging, So this is something that's great to give you just a firmer appearance. It gives your skin more radiance. It also cuts down on any redness as well. So you can use this you can use it at home, the Omnilux, we see that on the screen. You get great results with that. You have to use it a little more often than you would for if you were coming in office, because those are just a little bit stronger, but we offer LED light as any add-on treatments in the office.
And how are you using it in your practice, and what are you seeing as far as benefits go with your patients?
Oh, absolutely. So I add LED light on to just about anything. So you can do it with the Diamond Glow. You can do it with microneedling. You have the panel putting it on, letting the injectors use it right afterwards. You know, it helps cut down on some of that redness and inflammation, right? So my patients have been saying, oh my gosh, my skin, first of all, it's relaxing.
Yeah.
Let's just talk about how relaxing it is to lay underneath an LED light. I mean, I have to wake people up.
Yeah.
So they're like, okay, I got my nap for the day. So that was amazing. But yeah, an improvement in fine lines, wrinkles, texture, redness, you know, and they just, as soon as you come out, you definitely look like you have an overall glow. So the patients are loving it.
Very nice. We just brought on the Omnilux masks, which I think a lot of us have all purchased
Yes,
ourselves
yes.
and have been
Yes.
using. But yeah, I'm glad you highlighted the difference between the panel that we have is just the bulbs are stronger. There are more of them. So
Mhm.
the benefits are you can do that shorter. You can do a 15-minute, or you can do it daily. I mean, I had a patient back in the day that would sit at her desk and do LED, and her skin was amazing.
Yeah.
But she was doing it
Yes,
every single day.
Yeah.
So you have to be
yes,
consistent with the at-home ones. And then I'm glad you pointed out for injectors, bruising. We were just talking about bruising yesterday.
yeah,
That's such a big concern. People
Yeah.
don't want people to know what
Exactly.
they're doing. So if you can pop in front of the LED for
Yep.
15 minutes after injectables, it'll really speed up that healing time.
Absolutely. It'll reduce that swelling. It'll just help you feel overall better. Like there's so much research that is LED and it's fascinating,
Yeah.
quite honestly. I've had the Omnilux mask for a year and a half, maybe.
Yeah.
I got it before Synergy did,
She
and
was a pioneer.
I love it. I sit with it literally every night, 10
same.
minutes, and just like hang out on the couch. It also helps with melatonin production, so really good at night to help you get to sleep. So I like that.
Yeah.
Yes.
Go into the next treatment, which is one of my favorites, microneedling.
Oh, that's a good one. Microneedling. We were just talking about microneedling this morning, and my coworker was like, "Okay, I'm due for my next treatment. I need to get microneedling. It's a great anti-aging treatment." So, for those of you that don't know, microneedling is basically a treatment where we use tiny needles to insert into the skin to create a controlled injury. So when you create that controlled injury, it forces your body to produce more collagen and elastin. So you see a lot of people getting microneedling that are concerned with fine lines, wrinkles, texture, acne scarring, you know. And so since our body is constantly losing collagen, you know, you start to see that sag, and this is really going to help firm up your skin. So microneedling is great to do as a standalone. It's great to do it in conjunction with chemical peels and other anti-aging treatments. I told you we pair it with the LED light as well. It really helps cut down on some of that downtime, the redness afterwards. So it's a perfect treatment if you're looking to address those concerns.
And what do you say to people who are scared of needles going into their face?
I say, stop being a crybaby. No, I don't do that. But I do let them know that you do get numb, you know, for the treatment. We do put on numbing cream, and it doesn't really feel like needles are going into your face. It just kind of glides right over. I'm not going to lie and say, oh, it's a comfortable treatment like a facial, but it is not terrible at all.
Yeah. Yeah, our numbing cream, I feel nothing when I get a microneedling treatment. As far as discomfort, it's really very easy.
Yeah.
And
Yes.
the downtime is, I mean, what would you say, like
A day?
3 to 5 days of like,
If that.
yeah.
Yeah.
So we have 2 different types of microneedling.
Yes.
I wanted to show this picture. I love this picture.
Oh, he looks great.
He looks so good. You can see, so obviously his acne has cleared, but you can see some of the scarring that was formed around the acne. And after, I think this might have been 3 just regular microneedling treatments. I mean, he has back in those places where there were some divots and some crevices. Totally.
Yeah. And beyond that, look at how plump his cheeks are now.
I know.
Yes.
You know?
Right under his eye, you know, you can see some of that forming. Yeah, this is a great result from just basic microneedling. This is a young, healthy gentleman. So results that he's getting might be a little bit different than someone that's in their 80s. So we
Right.
have more advanced options of this same treatment.
Yeah.
Oh yeah, and this is
Yeah.
synergy.
Amazing.
This is what synergistic treatments do
Yes.
when you combine microneedling and I think she had chemical peels.
Yeah.
to offer.
Wow.
And
Wow.
after, I mean, really, the world is your oyster when it comes to post microneedling, what you can do.
That took 10 years off of her.
Absolutely.
She
I
looks
think
amazing.
too, a good point to that is these are not just one treatment.
Yeah.
These are a series
Right.
because you can do one of something and you're not going to be wowed.
Sure.
And that just goes for everything. It takes time to build collagen.
Yeah.
It takes time to get rid of those wrinkles. They didn't happen overnight.
Yeah.
It's been years and years and years that these things have slowly started to come about, and
Yeah.
now we're correcting them. So we have to be realistic.
Yeah.
You have to do a series of treatments, and that'll be specified to you from our expert team.
Yeah.
Yeah. And Emily made a great point. The other guy, he was a lot younger. So obviously the amount of treatments he's going to need is not going to be the same for someone that's a little bit older. So like you said, just tailoring those treatments to the patient.
Exactly. So for more advanced microneedling,
Yeah.
RF. What is RF microneedling?
Okay, so RF microneedling, it's going to do everything that regular microneedling does, but it also pairs it with radio frequency. So radio frequency is going to heat up the skin. It's able to reach down into the deeper layers of the skin. So with that, you'll see more of a tightening and firming. It's going to help lift the skin. It really helps out with people that are starting to, we start to see the first signs of aging around our eyes, our necks, and our hands. So we start to get that saggy neck. It starts to get very crepey. RF microneedling is great for that, the jowls that you get. So if you're looking to improve your texture on top of acne scarring, fine lines, wrinkles, you feel like you're not quite ready to, go under the knife yet, RF microneedling is a great option for you.
Yeah, it's a great. I think we have a clip too showing what this treatment looks like. So this is one of our estheticians performing microneedling with the radio frequency device. You can see it's a bigger tip. The patient's very comfortable, but what's happening is those needles are being inserted and they're heated, and that energy is being dispersed throughout the layers of the skin. So you're getting, to Mia's point, the lifting, the tightening, the collagen production. But look, I mean, there's very minimal like pinpoint bleeding. I think social media is a struggle for us because it's not always as aggressive as it seems.
No, not at all.
Yeah. We have other remedies too for comfort, like Pronox, numbing cream. We've got balls. I mean, there's a lot you can do to help get through these treatments.
Yes, absolutely. Absolutely.
So let's
Sofwave.
We are obsessed with Sofwave.
We really are obsessed with Sofwave. Sofwave is all the buzz right now. You get a Kardashian to mention it, and that's just it. It's everywhere.
2 years before them, just so
that's it. Yeah, exactly. Exactly.
Yeah.
That's it. I am loving everything about Sofwave right now. The results that we are getting from it is just tremendous. You got to show some before and afters for sure, because I am blown away. So for those of you that don't know what Sofwave is, it's an anti-aging treatment that utilizes ultrasound technology. So with the ultrasound technology, it's able to reach the mid-dermis, and that's where your body is producing that collagen and that elastin. So, I hear a lot of people say, well, will it cause fat loss or muscle atrophy, things like that. And I have to tell them, no, the way that the machine is designed, it's only reaching that mid-dermis in your skin. So you don't have to worry about those things, as any adverse effects. So this is great for the person that's not quite ready for a facelift. They're like, I just need a little lifting, a little tightening. Let's firm it up. Sofwave is FDA approved to treat fine lines, wrinkles, acne scars. It's great for lifting and firming the neck as well, just like the radio frequency microneedling that we discussed. And the thing that makes Sofwave so perfect is that there is no downtime associated with it. You can come into the office, get your treatment done, go right back to work. No one knows you had this done. So it's one of those treatments that we're seeing it take off a lot more now. And it pairs great with other treatments as well. So with this, it takes a little bit of time for your body to start producing that collagen. When you leave out of the office, you might see a little tightening, some firming, but it can take probably a good, anywhere between 3 and 12 months to see the full results.
Yeah, that there are a few treatments that you can walk out and like it looks like absolutely nothing has happened in a good way. There's maybe like a tiny bit of redness just from
Right.
on the skin, but within a few minutes you're totally back to normal.
Yeah.
Once you're done with the treatment, also what I like about it is there's no discomfort. During the treatment, it's a little like it's just a very strange sensation. It's hard to explain what it feels like, but once you're done, it's over. A lot of times after like laser treatment, you're hot or you've had a chemical peel, like the skin is warm or it feels like Sofwave is like you're in, you're out, it's over. You go on with your life. And in 3 months, you've got that beautiful lifted result.
Yeah, absolutely.
I think we do have some before and after. So yeah. Her jaw.
Her jawline looks amazing.
You can see that like snatched effect with her.
Even her cheek. I mean, you can tell, even her brow actually, that it really just like enhanced.
Yeah. So yeah.
Love this picture. I love this picture.
Yeah.
So good.
I think a lot of people can relate to having this type of neck situation happening where you're starting to see the sagginess, you're starting to see the jowls. She didn't want to go under the knife. She didn't want to do anything invasive. I want to say she had 2 Sofwave treatments.
She did.
How many would you say a year, Amia, are you recommending to people?
I would say on average, we do about 2 a year.
Yeah, just depending on
the laxity. Some people, start to see their results after 1 treatment. Again, it depends on their age, just the severity of their skin aging. But on average, I would say just to get them right where they want to be, where it's like, oh man, I'm so happy. My face is snatched.
Yeah.
Most people will do about 2.
Out too. And around her eye too. I mean, that looks really good.
Yeah.
Just you can tell all of it is like old.
Yeah, you can definitely tell in like her pre-gel sulcus area here
Mm-hmm.
that gel, like she has so much less crepiness.
Yeah.
And more tightness. It looks great.
It looks great. Good.
And another benefit from Sofwave, people are also seeing a reduction in their acne scars.
Yeah.
Because, it's building that collagen. So that's another plus from just getting that treatment done.
Absolutely.
Same with her neck.
That
seems
looks
to
so
be
Her neck looks great.
Whole face, like it just
lifted, tightened.
Facelift adjacent results with
well,
no downtime.
The technology is getting there. That's
Yeah.
the thing is there's a lot of research and saying that, people in their 20s and 30s may never have to get a facelift if they are treating their skin correctly. So you're using your SPF, you're doing your lasers, you're doing your peels, you're getting your facials, you're doing your injectables. So, I mean,
yeah, that's the goal.
Exactly. Start doing it now, little by little, and hopefully we'll never have to go under the knife.
Yeah.
Yeah. And home care is so important as well. We really need to highlight that. We were talking about the SPF, but another thing that really pairs hand in hand with collagen production is vitamin C. Your body uses vitamin C to produce more collagen. It helps to activate those fibroblasts. So I think that that's something that's really important to pair with all of these treatments.
Yeah, absolutely.
Yeah, let's go into our next treatment, which is Radius.
Yes.
So now we're getting into some injectables, getting a little more advanced.
So Radius, similar idea to Sculptra, which we'll also talk about. It's a biostimulator. So it's not a traditional filler made up of hyaluronic acid. It's actually made of calcium hydroxyapatite. Big long word for a biostimulator. Okay, that's what it's actually made of. It's going to boost your collagen 1 and 3 for radiesse and your elastin production. So this can actually be used to strengthen bony structures. We can use it throughout the face, neck, chest. I love it for above the knees and behind the elbows where those get nice and
Very
crepey. And
crepey.
people
Oh,
forget that, oh yeah, that's an area. Why is my face looking good, but my elbow's looking a little baggy? So this is a great one for that area. I've seen it work in as little as 30 days. It's incredible. So I love hyperdilute radiesse, which is just how we mix it. I love it just by itself as the biostimulator along jawline, in the cheeks. I choose this for usually those older patients that I'm like, it's going to take about 7, 8 syringes of HA to get us to a place where you're looking more volumized. I'll use radiesse instead because it's a good option for certain patients. So it's a favorite of mine for sure.
Ooh.
Yes. So the areas you can treat.
Yes.
So hands are a big one, right? Like nobody wants,
The
where do
veins.
you see people age? Hands. I always look at hands and neck and it's like,
Yep.
oh, okay. They are doing the right things for their face, but they're not bringing it down. So hands, neck, face, we can do elbows, knees, décolleté. We can even do a non-surgical BBL with radiesse. So if you're like, I have those little hip dips, so you're
Yeah.
yeah.
build that right in with a little radiesse and
Oh,
it
yeah.
beautiful. Does it take a lot of syringes? Yes, it does. So
It's a big area.
exactly. So we can always talk about that.
Yeah.
Yes.
Ooh.
So this is a beautiful patient of mine who had 1 syringe of hyperdilute radiesse in her whole face. So we did all in here. Look how she just has this like overall plumpness. And this was a month after. She is
Wow.
fabulous now. She literally canceled filler appointments after having this done because she was like, I don't think I need anything. And I was like, I don't think you do either. Like,
she's someone that I think a lot of people would look at the before. I mean, she's stunning.
Stunning.
She's absolutely beautiful. And I think a
Yes.
lot of people would be like, what does she possibly need? But seeing the after result, I'm like, oh, this makes so much sense. Why you
Yes.
didn't do filler
exactly.
and just
Mhm.
give her that
Right.
like feminine structure back that she was maybe feeling like was
Exactly.
going away.
Because people think, oh, I need more cheeks. And this beautiful girl did not need more
No.
cheek. She
She would have
needed
looked overfilled.
Exactly.
She would have.
not the look we're going for. We're looking for natural,
Natural.
good results that are going to just improve over time. And that is one beautiful thing about the biostimulators. You know, she looked a little gaunt in her previous picture. So her transition from her cheek to her jawline was just looking a little indented. So that's really what it helped to correct. I mean, beautiful, beautiful.
She looks great. She looks great.
This is really good. Let's go to
Ooh.
Sculptra.
Yes.
Sculptra. Okay, this is exciting.
I love Sculptra. You guys, if you're in my treatment room, know that I love Sculptra. Sculptra is for every single patient. I don't care if you're in your 20s doing 1 vial, even to just stimulate that collagen to get it back to where we need to be because we're losing it. Again, we don't want to hit 30 and then be like, oh my God, I have sagged off the world. Like, it's not what we're looking for, right? So just a little start. We could do a little Sculptra. It's also going to give you this gorgeous glow.
Yeah.
So Sculptra is a biostimulator. Unlike radiesse, it's made of polyl-lactic acid, which is a fun way of saying a particle that's essentially causing a controlled trauma under the skin. So I say it like this in the treatment room. It's like a laser deeper than a laser can get to build that collagen. So I'm not saying don't ever get your lasers. I'm saying you got to do both.
Yeah.
If you're looking to like just go, that is exactly where you need to start. Is you need a little Sculptra, and usually treatment depends on your skin laxity, what you're doing at home. but they say about a vial for every decade that you've been alive. And usually the first one, I wait. My patients will know this. Like, I wait to see you a month later and see how that settled and say, I was thinking we would do 4, but I think we might need to do 3 instead.
Yeah.
Or whatever the case may be. I am very much let's see how your body is going to react to a treatment. But Sculptra, we have only research that says it lasts for 25 months because they did the study for 25 months. I would bet that it goes even longer. It is one of my favorite treatments because you get an instant result. Literally, the first time I put that needle in, I go, oh, wow. Every patient, and they're like, still amazed by this stuff every time I use it, which is almost daily.
Yeah.
I love it.
I love that it's like going in this direction too, a more structural, how do you use your body? I mean, we love filler. I do think there's a place for filler, but like stuff like this just makes so much sense.
It does. You have to start at the bottom. And I really do think that before we're hitting those fillers, let's see where we can get your skin at, especially if you're in your 50s and you haven't been on good skincare or you haven't done any skincare. We need to start building that collagen back up. And then we can talk about volume replacement.
Yeah.
There's a place for everything. And it's all in what you are looking to do.
Right.
It never has to be what I think is the best. It's what you think is worth it for you.
Yeah. Yeah.
Absolutely. And they pair so well together with the aesthetic treatments. It doesn't have to be one or the other.
Exactly. It's very synergistic.
Yep.
So this beautiful person, some of you may know, but this was after her very first Sculptra treatment.
Yeah.
So before, after, you can see, and we're about to do her 3rd this weekend. Oh my God, her results are incredible. I make her come in the treatment room if she's here to just show people her face, and she's probably sick of me, but the results are so good. We really focus down here. She is not a person that really likes a lot of fillers. She doesn't want to do them. She's more the natural approach, which I appreciate.
She has a small face.
She
does. Could definitely overpower her. I could see why she would.
Exactly. And she really doesn't need it, in my opinion. Doesn't need to have a bunch of fillers to lift her up. She needed that hollowness and her lower face to smooth out, and where she was getting that laxity. The collagen building is beyond impressive.
Yeah.
Beyond impressive.
Let's go to the next photo. Woo! Wow.
Oh, yeah. She had a drastic result. Now, these are, I believe, year difference. So look at where she was at compared to later on after allowing that biostimulator to do its job.
Yeah.
Wow.
It's absolutely incredible. Now, she also had her lips done, so that may throw some of you off as well. The lighting is really good. I'm super picky with how pictures are. Her jawline.
Yeah.
Look at how it just, I mean, she had a great jawline before, but now it's like she isn't missing that upper face volume that she was previously. She's probably continued on her skincare journey. She's probably done peels and lasers as well, but absolutely stunning results just from Sculptra.
Yeah.
Oh, this one I love.
Wow.
Love.
Wow.
Look at,
are you
just wow.
I mean,
that's insane.
That is so good. Like,
oh my gosh.
Outline. Now, she probably had, and I don't know specifics, so I apologize, but she probably had several, sessions of Sculptra. She honestly looks like maybe she would have had a little bit of filler, maybe, but honestly, if she did, her cheekbone is there.
Yeah.
We were just revolumizing that fat pad that fell down, right? So it's a revolumization.
Yeah.
Just from the collagen loss, that's what's creating that sagginess.
Beautiful.
That looks amazing.
These are just some of Sculptra's photos.
Yep.
We can kind of go through these.
Yeah. They have great results. These are 2 years out, I believe. It just shows that it keeps getting better and better once you finish your treatment series. So a vial for every decade, 3 to 4, 5 sometimes. It really depends on your skin's health.
Yeah.
And we're going to assess that when you're in the room.
Yeah. PDO.
threads. Yes. So lots of different ways to use PDO threads. What they are is they are suture material that breaks down, again, a controlled injury inside that layer that we're looking to build collagen. So smooth threads are great for recollagenization. For lifting, we can also use barbed threads. It's the right patient though. I'm very particular with who I'm going to put a thread in because these are not going to give you facelift results.
Right.
It's going to continue to tighten, build collagen over time. However, if you're sagging so dramatically that you really need a facelift, I'm not going to give you the most bang for your buck with threads. And I'm going to tell you that. We're going to have to start somewhere else. We may need to volume replace. If you're like, nope, facelift is out of the question, we're going to start somewhere else to begin with. That's just my take on it. Threads have their place, and I do love the recollagenization. I use them right here a lot and right here a lot to help with those fine lines. There is nothing like threads here for those perioral wrinkles, the smoker's lines. I love them there. I mean, you almost get an instant result and then it gets better.
Yeah, I've seen you do threads and I can see how it needs to be a very specific person to get results from this.
Absolutely.
And why you would maybe start somewhere else. Yeah,
she got stunning results.
For cheap.
I mean, fully, we're taking that fat pad. Essentially, you're trying to grab that fat pad and move it back up because where does everything go? Gravity makes us fall down. So we're trying to just grab everything, and barbed threads are a lot like Velcro. That's kind of how I describe them, is once they go into the tissue, they are attaching like Velcro, and then we're pulling up and you hear clicking. You know, there's lots of nuances to it, but I love her results. I love her results.
Great. Through here, like this nasolabial fold area is really just.
Exactly. I mean, stunning patient to begin with. Just started her injectables journey. Love everything that we did here. She just, I mean, her under eyes in the pictures, like we didn't touch her under eyes. Look at how good they look just from putting that tissue back where it belongs.
She looks refreshed. She looks refreshed.
Exactly.
That's it. And now, Laura, let me ask you a question. Because, some people are saying, social media, I see threads. Oh my gosh, that looks so scary. I would never. Could you talk a little bit about just the comfort of that, or discomfort, I should say?
Yep, absolutely. So we use lidocaine with epinephrine, which helps to constrict your blood vessels so that we're not, hitting them and causing major bruising, although that is a possibility with anything we do here. There is no getting around that. There's swelling and bruising, even if you're getting Botox. I try my best. Everybody tries their best, but that's where we're at. It is I don't lie.
Right.
A little barbaric. Like threads are not something simple. I have to take a very large cannula and put it down into your tissue, but I make sure that you're already numb for that.
Right. That's the thing.
I know where your nerves are, when it's going to be uncomfortable. So just knowing all those little nuances is super important for the provider that you're going to see doing threads. I am always fine if patients want to numb. If we want to use Pronox, we can totally do that. They're going to be uncomfortable for a few days. You're going to have certain precautions. You're not going to be able to go and eat a big old burger or sub. Like you're going to need to follow the directions for these if you don't want them to come detached. That's always a possibility.
I would encourage people to not watch them on social media being done if you are interested. It's not going to help your journey at all.
Exactly. Love it. Love to watch it. Fascinated. Completely fascinated. However, if I showed my husband or friend, they'd probably be like,
it's not necessary.
Like, what are you doing? No.
Exactly. Right. So
some things are best left just behind the scenes.
Exactly.
Agreed. But we live in the age of social media right now. So
get away from it.
People are going to ask.
See somebody who's an expert in it who can really walk you through.
Yeah, agreed. Let's see. Okay, and we'll just touch on this, Mia, and then let's get to some questions.
Absolutely.
We were talking about skincare earlier. Let's talk about plated for a second.
Yeah, so yeah, like you said, we were talking about skincare earlier. We highlighted vitamin C and sunscreen. Uh, Plated it has a special place in my heart. I think we all know that, okay? Plated has been amazing. We cannot keep it on the shelves here, and for a very good reason. So what it is, it's a platelet-derived exosome serum. So exosomes are little tiny messenger molecules that are, made up in your body, and they have protein, cytokines. They also have growth factors. So this is perfect for the person that is starting to see fine lines, wrinkles. It's great for redness. It helps even out your skin tone from any photo aging. So for people that are starting to see, those sunspots that you get as you get a little bit older, it's going to help even out your skin tone. This is something, I don't even like to call it a serum. I like to call it an at-home treatment because it really is that powerful. It's something that you only need to use one time a day. So I like to use mine at night. That's when your body is repairing itself. So we can really focus on stimulating that collagen. But one pump, one time a day, that's all you need.
Awesome. All right, let's get to some questions.
Oh, let's see.
Here's a fun one about collagen. Is collagen absorbed through the skin or do you have to ingest it?
So there's some fun research out there suggesting that collagen that you take orally isn't really ingested or isn't really absorbed by your body very well. So, and it's not something we can put on topically to regenerate the body's natural collagen. So you can't just put collagen on to regenerate it. You need to have some type of controlled injury. So whether that's, even so much as like your Botox needle going into your forehead every 3 to 4 months, you're stimulating collagen.
Yep.
If you think about it, if you accidentally cut yourself and you get this like little scar that starts to form, what is that? Collagen. It's recollagenization. So you need to get down into that layer where collagen is made in order to actually get the true benefits. Now, do I think it's a bad idea to add collagen to, your supplement routine? No. There's a lot of research out there.
Joint.
Yep, exactly.
Yeah.
Things like that. But I do think finding the right one and a research-backed company is your best bang for your butt.
Yeah.
Yeah.
I think this patient is asking, and Amia, I'll direct this to you.
Okay.
I think they're asking, is sunscreen only necessary if you spend time outside?
Oh, that's a great question. And so many people ask that. So what I would say to you is even if you're indoors, if you are exposed to the sun, if you have windows, the sun can get in. If you're driving, it comes in that way. I always tell people when people come in to get a Visia done, the first thing I ask is, do you drive? And they say, yeah. And they say, well, that's a weird question. And the reason why I ask that is because most of your damage is done on your driver's side. That window acts like a magnifying glass for the sun. So if you're going to be in your basement with no windows, nothing like that, by all means, keep your sunscreen off.
Yeah.
But if you are exposed in any capacity, definitely make sure you're putting it on and make sure you're reapplying.
Absolutely. I think it's just a great habit to get, even if I know I'm probably not going to leave the house.
Yeah.
It's just a great habit to get started in your teens.
Yeah.
That's really the only thing you're doing at that age.
Yeah, 100%.
Just get in the habit of putting it on. Once you've established that habit, you won't think about it and it'll just be a part of your day to day.
Exactly.
So make it easy for yourself and just put it on.
Right. That's it.
I like this question a lot. Can you do any of these treatments, RF microneedling, Sofwave, while also getting Sculptra?
Absolutely.
Yeah.
Nothing. This is what I tell people in general. You cannot mess up Sculptra because you need to massage it. You need to do all of these things. Now, do we usually wait a week after you've had Sculptra to do like a laser lasers will pull water out of your tissues. So yeah, you may lose a little volume, but it's really going to just continue to stimulate. So you can absolutely do all of those things. You could come in and have a Sofwave session or an RF session and we could do Sculptra theoretically at the same time, and
Yeah.
it's not going to hurt it.
Yeah.
Right, right.
To kind of go along with that, if you get PDO threads, does that mess things up if you want plastic surgery later?
So I feel like this could be debated among plastic surgeons. I am not a plastic surgeon.
Yeah.
Let me preface it with that. Have I been in the OR when threads have been taken out? Yes, I have. For the most part, I think that any of these treatments, if a plastic surgeon is telling you not to get any of them, and this is my personal opinion, I think maybe seek a second opinion. And here's why. They should be comfortable in what they're seeing when they're dissecting your face. They should be able to find the plane that they need to be in. They're also putting sutures into your SMAS, which is a layer, and retracting that back up. So that's kind of my thought on that is if a plastic surgeon is telling you, oh, don't go get Sculptra because then I can't do a facelift. I don't think I'd want to go see that plastic surgeon.
Yeah.
But that's personal preference. I want somebody who is very knowledgeable in all injectables because this is also their field.
Yeah.
Mm-hmm.
I think we touched on this a little bit earlier, but does Sofwave dissolve some of the fat layer under the skin with heat? Also, can you have Sofwave done first, then Sculptra?
Absolutely. Yep. We did touch on that a little bit earlier, and that is a myth that's out there. So for people that don't know, Sofwave kind of copied off of All Therapy. And so All Therapy could go just a little bit deeper than what Sofwave does. The reason why we don't need to go that deep is because we only need to target the mid dermis, which is where that collagen and that elastin is produced. So it's not going anywhere near any adipose tissue, won't cause any muscle atrophy. And you can 100% do that with Sculptra, 100%.
Let's see. Thoughts on Korean sunscreen. I want to take this one, you guys.
Oh, okay, okay.
Here are my thoughts on Korean sunscreen. Just wear it. It doesn't matter. Just put it on. Find one that you love and wear it. As long as it's zinc oxide or titanium dioxide, one of those, I think you're good.
Yep.
I think if you like it, wear it.
Put it on.
Put it on.
We don't care.
We don't care.
Just put it on.
There's great ones everywhere.
There's great ones everywhere.
Yes.
Just find what works with you. The only difference is chemical versus physical. So chemical is going to heat your skin. Physical is not going to heat your skin. So if you're more irritated, sensitive skin type, go with physical. If that doesn't matter to you, if you don't have melasma,
you want to go out,
go with chemical.
Yep, absolutely.
But just wear it.
Good girls.
Okay, let's go to where to begin.
Yeah.
Especially if you don't have an endless supply of cash. Is Sculptra better than Sofwave?
It kind of depends. It depends on what you're looking to do. And I think where it's important for you to come in and have a full face assessment with myself or have a Visio with an esthetician, and we can do it same day as well. I think that they offer different things. If you want to see more of a quicker instant type of result, maybe Sculptra, but I think it depends on every person. And we actually talked about this the other day. If you don't have a lot of money to spend and you're like, I want to see some result, start at your basics, start at your skincare.
Yeah.
Like,
right, exactly.
I will personally attest to, you can go on my Instagram and see where my skin was at 2.5 years ago. Insane difference. And I use skincare daily.
Yeah.
Like, and yes, I have the benefit of being here, but also I've researched and learned a lot. So that's one thing, my patients, I'm always happy to talk about their regimens and what we can add, change. There's not all bad things at the drugstore, but they're not as effective as stuff here.
Yeah. Yeah.
Right. You really don't want to skimp on your treatment products, you know, like your vitamin C's, your plated, you know, that's a good place for you to start. That's the foundation.
Right.
And so just like Laura was saying, I think that they both offer great benefits. It's just a matter of, you know, what areas are you concerned with? You know, are you more focused on your neck? Are you focused on both? You know, so coming in for a consultation is always the best way to start.
Absolutely.
Absolutely. I know we have other questions. We will go through the rest of these questions. I'm sorry if we didn't get to answer, but we will send answers out for these because there are some amazing
Really good
questions on here.
questions.
I did want to talk about our Fab Beauty Vault membership while we have you all here today. So if you are looking to save a little bit of money and you know you want regular treatments, we have just launched our Fab Beauty Vault, which allows you to, we're very excited about this.
Yes.
Very,
Yeah.
very cool. It allows you to deposit $199 a month. That is not a membership fee. That goes into your vault and unlocks 15% off med spa services, 10% off products, 20% off laser skin packages, 50% off add-ons, you name it. The perks are there, and that money you can accumulate it. You can use it, you know, as you wish. It stays in your vault. It never expires. But it just allows you to basically have Fab. If you're familiar with Fab Week, it allows you to have Fab Week all year long. So we are very, very excited about the Beauty Vault.